Hi, everyone. This is Dr. Larry Conway. I'm Director of Cardiology here at the Melrose Wakefield Cardiovascular Center, and delighted to be with you. I'm going to talk a little bit about heart disease, and particularly what are the risk factors for heart disease. You may notice when you go to the doctor's office, the doctor talks to you about certain things in your life, your lifestyle, your history that may put you at risk of heart disease. It's so important because heart disease is the leading cause of death all across the world and certainly still in the United States. And I, as a cardiologist, do everything we can to prevent it. If we have it, we treat it. So what are the risk factors? It's actually really interesting how we figured out the risk factors of heart disease. And it started in Boston. In 1948, in Framingham, Massachusetts, the U.S. Congress asked leaders of expert cardiology in Boston to see if we can figure out why heart disease happens. And so they studied 5,000 residents of Framingham, Massachusetts. And they asked them millions of questions, and what they found is that there's certain things in people's life and lifestyle that predisposes us to heart disease. What are they? Well, the first one they found is that if you have high blood pressure, high cholesterol, smoke, or have diabetes, those are all things that over the years, and this wasn't known in the 1940s. But we found out after asking thousands of patients and monitoring them, these are things that put us at risk of having a heart attack or stroke. Interesting, there's 5 generations of Framingham residents now who have been part of this study, and it's a study that we use every day. Thousands of patients, lots of data points, and it's really interesting because if you go to my office now, one of the cardiologists or your primary care doctor, they'll get their cell phone, they have an app, and they'll quickly put in your information and say, well, what's the 10-year chance you might have a heart attack or a stroke? And it helps you and your doctor figure out strategies to prevent that. So let's go through a couple of them. Smoking is very important. We all know that smoking cessation is probably the most important thing you can do to put you at lower risk of heart attack or stroke. Diet's very important. There's lots of controversies. You go to the supermarket and there's a new fad diet and an actor and actress has lost a lot of weight. But what do we really mean by diet? It's just so important to eat a healthy diet, and that means consuming lots of fruits and vegetables. That's a bit what our grandmothers told us. Limiting empty carbohydrates and junk food, having a little bit of protein and vegetables in your diet every day. And it's pretty much as simple as that. Fad diets don't work, healthy diets do. What about exercise? Exercise has been shown in the Framingham study to be so important in preventing heart disease. And there's actually part of the Framingham study was a nurses' health study where it's important that studies are done in women, because women are just the same risk of heart disease as men. So they studied thousands of nurses in Boston, and they found that nurses that go for a walk every day were at the lowest risk of heart disease. One thing that I think is interesting from this study and some recent studies from England is that you don't have to be a marathon runner to reduce your risk of heart disease. It turns out that the really good 4 to 5 day a week exercise for an hour, or even just get 5,000 steps on your Fitbit, really reduces your chance of heart disease. And so all of us out walking every day, going for a walk, we see a healthy population. What about diabetes? It's so important. Diabetes is weight related, so it actually speaks back to the diet part of it and the exercise part of it. It's important to go to your doctor to have your blood pressure checked. Blood pressure goes up with every decade of life, so if you're 20% chance of having high blood pressure. If you're 80, it's an 80% chance. That's why we go to the doctor. They take your blood pressure all the time because it may change over a lifetime. Genetics are really important, and we're going to spend a little time talking about the genetics of heart disease or a family history of heart disease. And you'll see when you go to the doctor asks you about your family history, and it's really important. The definition of the family history of heart disease for you is that if you have a male relation, a brother or father who had heart disease at age less than 55, that puts you at risk of heart disease going forward. Or if you have a sister or mother who had heart disease below 65, women tend to get heart disease later in life because they're protected by female hormones. So it's not that it's not important that grandpa had heart disease in his 80s, but it's particularly important that someone in the family had heart disease as a young person, and we need to know about that. What's a little sobering is that we can't really change who our parents are. And so, well, what do you do about that, doc? Well, it turns out, also from the Framingham study and research done in Boston, is that if you are at risk of heart disease because of family history, by simply eating a good diet and going for a walk every day, you can make that risk in half. So cut it in half, even if you do have the genes for heart disease. What's in the future is that, there's probably about 200 genes that cause heart disease. We know about 50 of them now, but probably not, maybe when I'm not practicing, but maybe when my son is, that down the road, you'll put your genetics into a little vial of blood and they say, oh, here are the 200 things that add up to the possibility of heart disease. And just like the calculator now, to calculate what your risk is, they'll put that into your phone and say, well, Mr. So-and-so, you have the risk of heart disease with this. But the answer is still going to be the same. Eat a healthy diet and go for a walk every day. It's so important.